so I'm going to be drawing out my med before I enter my patient's room. The order is 7 milligrams of morphine sulfate IV push one time now. So I calculated and my dose is going to be 0.7 mLs. But before I do anything, I'm going to wash my hands. And then put my gloves on. Okay. So my vial is 10 milligrams per ml. So I'm going to be drawing up 0.7 mLs. But before that, I'm going to swab my vial here. And I'm going to pull up 0.7 mLs of air to push into my vial. Remove my cap. Inject my air. And pull up 0.7 mLs. And monitor for any bubbles to remove that. Okay, that looks good. Okay, now I'm gonna recap. And now I'm gonna dilute it with 8 mLs of saline, but I'm gonna remove 2 mL so that way there's enough room for my med to go in. Remove the bubble. And thickening. Okay. So now I'm gonna reconstitute or dilute it. First I'm gonna open it up so there's air. There's room for my med. There you go. Check the needle in here. Oops. Recap. And recap my syringe here. Oh, first, let's remove the bubbles. There you go. And now my med is ready, so I can label this my med so it doesn't get confused with my saline flush. And then we're gonna go enter the patient's room and administer their med. Hi, my name is Darlene. I'm gonna be your nurse today. Hello, Mrs. Walsh. I have some medications to give you, but first, can you tell me your name and your date of birth?
Maureen Walsh, 1/31/1980.
Okay, very good. Are you in any pain right now?
Yeah, I'm in a lot. Probably 9 out of 10.
Okay, so I have some pain meds for you. It's called morphine. I'm going to be administering it through your IV here. I'm going to administer it over 45 minutes because if I give it too fast, it's going to sting you a little bit. So the dose here is 0.7 mLs. And I diluted it in this normal saline here because, like I said, if we give it too fast in a short amount, it's gonna burn your IV a little bit. So for this med, you're gonna be receiving it every 4 hours as needed for your pain, and the route again is through your IV. So I'm gonna scan your badge here, boop, and scan your med. Boop. Let me put my gloves on. Are you allergic to anything?
No, not that I know of.
Okay, good. So before I give this med, again, this is for your pain, so moderate to severe pain, and you stated that your pain is a 9 out of 10. Some side effects that you could be feeling is respiratory depression, where your breathing is going to slow down. Also orthostatic hypotension, meaning like your blood pressure decreases. You could feel a little constipated, so if you start to feel that, if you want, we could give you some laxatives or stool softeners to help with that. So I'm going to be monitoring your vital signs to make sure that your respiratory rate is okay and your blood pressure is not too low. But if you start to feel lightheaded or dizzy, just get up slowly and we'll help you if you need help with that. Okay. So first, let me get my hands free. So I looked in the drug book and all those side effects are just what I stated. Do you have any questions?
No, not that I can think of.
Okay. So if you had a line running, which you don't right now, what I would do, if it weren't compatible with the morphine, I would disconnect your line, flush it with normal saline to remove the extra, or to flush down the other liquid, administer your med, do another flush, and then reconnect you. But since you don't have any lines running, we're okay. So first, let me open all my saline flushes here. And before I came in your room, I labeled the med flush here so I don't get it mixed up with the other normal saline. So first I'm going to swab your IV line here. Grab my first flush. Pull out the air. Connect here. And I'm going to flush it with about 5 mLs. I'm going to unclamp here so it goes through. And just flush it with 5 mLs. Does that sting a little bit?
No, it's okay.
Okay, any pain?
No.
Okay, good. Okay, so that was the first flush. Clamp it, and then now I'm going to give you your med here. I'm going to unclamp. And like I said, I'm going to be giving this med over 4 to 5 minutes so that way it doesn't hurt as it goes in. Okay. You're going to start feeling the effects about 5 to 10 minutes as the med starts to work. We'll clamp again. And then lastly, we're going to flush one more time so the last of the med goes in. Again, I'm going to pull back my air, draw it out so there's no air bubbles that go in. Unclamp. I'm going to flush again with about 5 mLs. I'm going to clamp here. And then I have a blue cap here to clamp it. Okay, Mrs. Walsh, we're all done. Do you have any questions before I go?
No, thanks.
Okay, very good. So here's your call light. And here's your bedside table. Let me know if you need anything else, okay?
Thank you.
Thank you.